Hello, this is Dr. John Wallman. We're here today with another in the series of Reasons for Calm regarding COVID-19. This episode is going to focus on who is high risk and why and how to shield them. Okay, for the very high risk criteria, and these are from the United Kingdom government, National Health Service. These are very high risk conditions. They've had people who've had transplants, kidney and liver transplants, treatments for certain cancers, long-term lung disease, were born with conditions that make the body, blood, or cells work differently. Something to do with some of the relatively rare immune-compromised genetic conditions. Taking drugs that reduce your body's ability to fight infections and are pregnant with significant heart disease. So these are very high risk conditions. Now, the high risk criteria, these are from the CDC, the US. People age 65 years or older, people who live in a nursing home or long-term care facility. Other high risk conditions include chronic lung disease, moderate to severe asthma, people with a serious heart condition, people who are immune compromised, including cancer treatments. I'll go into just a little more detail on that in a moment. People of any age with severe obesity and certain underlying medical conditions, particularly if not well controlled, such as diabetes, renal failure, liver disease. Those categories might also be at risk. People who are pregnant should be monitored since the risks are not known regarding severe viral illnesses. However, to date, COVID-19 data hasn't shown any increased risk. Now, a little more detail on the CDC high-risk criteria. We have this quote: many conditions can cause a person to be immunocompromised, including cancer treatment, smoking, bone marrow or organ transplantation, immune deficiencies, poorly controlled HIV or AIDS, and prolonged use of corticosteroids and other immune weakening medications. Okay, so what are the high-risk population's mortality rate? Well, overall, if we look at the mortality rates in the US on March 23rd, in the USA, the mortality rate was 1.2%. And that was down quite dramatically from where it was in the first couple of weeks. And it's anticipated that the mortality rate will continue to drop with a temporary rise during the period where we're rounding the top of the curve, as they say. So infection rates. These are patients with underlying conditions have a 20 to 50% heightened risk of getting COVID-19. Okay, so it's not just dying rates, but it's also infection rates go up with people who are in the high risk category. Now, if we look at the mortality rates based on these underlying conditions, now this is not looking at age. So whatever age, if you have cancer, the 5.6 is the mortality rate with COVID-19 versus the national mortality rate of 1.2. And this basically represents a 4.5 times the increased rate of mortality compared to the general population. High blood pressure, uncontrolled high blood pressure, a 6% mortality rate with COVID-19, and that's 5 times the general population rate. A chronic respiratory disease, 6.3% mortality rate versus the which is 5.25 times the national average. Diabetes, 7.3% mortality rate, which is 6 times the national mortality rate. And cardiovascular disease, 10.5% mortality rate. This is 8.75 times the national mortality rate. So this gives you an inkling for the types of underlying conditions and how much more of a risk this puts you at. So this is basically coming down to the point of helping us identify who the high-risk people are. And now we go into what needs to be done regarding this. But before we do that, let's look at who are the low-risk people. Well, this is most people. The Inspector General at the World Health Organization said on February 28th that most people will have mild disease and get better without needing any special care. End quote. And Journal of the American Medical Association on February 24th had this statement. Quote, current best estimates is that about 81% of people with COVID-19 will have mild disease. End quote. And by that, they were referring to either undetectable or insignificant. 80 to 86% of the people who get infected will have no or limited symptoms that don't result in a hospital or doctor's office visit. So low risk, the vast majority of the population is low risk. So this brings to mind some of the things that have been emphasized regarding treatment. Right now, we've been emphasizing quite a bit, treating 100% of the population to protect the 1% or so. That number is not hard at this point. The high-risk patients. More emphasis needs to be placed on protecting and treating the 1% of the population, again, an estimate there, that is the high-risk patient. Okay, United Kingdom put this out. How do you shield the very high-risk population? Quote, shielding is a practice used to protect extremely vulnerable people from coming into contact with coronavirus. Now, they sent a letter out to everybody in their database in the country who was in the very high risk category. And in this letter, they said, quote, you are strongly advised to stay at home at all times and avoid any face-to-face contact for a period of at least 12 weeks from the day you receive this letter. Okay. And they followed that up with say, please note that this period of time could change. Okay. They continue on. Visits from people who provide essential support to you, such as healthcare, personal support at your daily needs, social care should continue, but cares and caseworkers must stay away if they have any symptoms of coronavirus. You may find this more guidance on the home care provisions link. All people coming into your home should wash their hands with soap and water for at least 20 seconds on arrival to your house and often while they are there. Basically, you have to be assuming, and this is an end quote now, you have to be assuming that a large percentage of the population is going to be infected. Assume everybody is infected and they have to be kept away from the high-risk population. Okay, so there's additional detail on the link below. And the high-risk population. Now, this is from the California Department of Public Health. And this they sent out or are putting out there as, quote, measures for older adults and those who have elevated risk individuals. Number one, remain at home until further guidance is issued. Cancel any non-essential travel, appointment, etc. Continue with outdoor activities. Practice social distancing both in and outside of the home. Okay, so this is very, very key and is not being emphasized enough. High-risk population should remain at home until further guidance is issued. There's not enough emphasis being placed on protecting the 1%. Assume everybody has the disease and many are carriers and not showing any symptoms at all. Okay, this is from David Katz, president of the True Health Initiative, Yale Griffin Prevention Research Center, and he published this in the New York Times last week. Quote, the clustering of complications and death from COVID-19 among the elderly and chronically ill suggests that we could achieve the crucial goals of social distancing, saving lives and not overwhelming our medical system, by preferentially protecting the medically frail and those over age 60, and in particular those over 70 and 80 from exposure. So Dr. David Katz is emphasizing this point that it is isolating the seniors with underlying conditions, the high-risk population, from exposure, isolating, quarantining high-risk people in their homes. And this was also reinforced by Naftali Bennett, Minister of Defense for Israel. Quote, "The single most important insight of the entire corona epidemic, more than general social distancing, more than testing, more than anything else, is to separate old people from younger people." That needs to be the focus of the current strategy. Thank you very much.